Exercising your pelvic floor muscles. Where is the pelvic floor? What does it do? Are your pelvic floor muscles working? Pelvic floor muscle exercises. Where is the pelvic floor? As was described in Module 1, the pelvic floor is a hammock of muscles and ligaments that stretch from side to side across the bottom of your pelvis. It is attached to your pubic bone in front and to your coccyx or tailbone behind. The three openings that pass through the pelvic floor are the urethra, the vagina, and the anus. This is a side view of the pelvis. It shows the relationship between the pelvic floor below and the organs of the bladder, uterus, and rectum. The pelvic floor is at the base of a group of muscles called your core. There is a functional relationship between pelvic floor, diaphragm, the abdominal muscle called the transversus abdominis, and the back muscles called multifidi. These muscles work together as a team. What does the pelvic floor do? Why is it so important? In Modules 1 to 4, we talked about the functions of the pelvic floor. It supports the uterus, bowel, and bladder. It helps control the bladder and bowels. The pelvic floor works together with muscles of the back, abdominal wall, and diaphragm to support the spine. It plays an important role in sexual function and pleasure. It helps control the pressure inside the abdomen to deal with the pushing down forces that happen when we lift or strain. This is a video of a pelvic floor contraction and relaxation. It is a side view of the pelvis with a woman lying down on her back. Pelvic floor exercises. How can you feel your pelvic floor muscles contract? If you insert 1 or 2 fingers in your vagina, can you feel the pressure the pelvic floor muscles squeeze around your fingers when you tighten your pelvic floor? Do you feel them relax after? This video is a side view of the pelvis. The woman is looking to the right. Can you stop or slow down the flow of urine halfway through emptying the bladder? Remember, this is just a test to find out where the muscles are. Do not do this on an ongoing basis or as a regular exercise, as it can be confusing to your bladder. Can you tighten the muscles around your anus as if to stop passing gas? Are your pelvic floor muscles working? How do you do pelvic muscle exercises? As you tighten your pelvic floor muscles, do not tighten your legs, bottom, or tummy. Do not push down or hold your breath. It is very important to focus on the full relaxation of the muscles after the contraction. Pelvic floor muscles need to be able to contract and relax. 2 ways you can exercise your pelvic floor are slow and sustained. Squeeze and contract your pelvic floor muscles slowly and work up to holding your contraction for 10 seconds. Then relax completely. Repeat 10 times. Quick and short. Squeeze and lift your pelvic floor as quickly as possible. Hold this contraction for 1 second, then release. Repeat 10 times. Practice these exercises regularly, 3 times a day. Start by doing these exercises in a position that is easiest for you to feel the muscles, typically lying down. Over time, progress to sitting and then standing. It can take 6 to 8 weeks of regular practice to notice improved pelvic floor function. If you have difficulty feeling the pelvic floor relax, it could be because your pelvic floor is tight. Some women with a tight pelvic floor may experience constipation or straining on the toilet, pain with intercourse, difficulty emptying the bladder completely, or pelvic pain. If you have a short, tight pelvic floor, you will need to learn how to relax these muscles. A pelvic health physiotherapist can teach you how to do this. Sometimes difficulty feeling the pelvic floor relax is because the pelvic floor is weak. You may not notice the relaxation because it has already happened. This can be the case when these muscles have poor endurance. Pelvic floor physiotherapy. If you are not sure if you are using the right muscles or do not notice results after 2 months of regular practice, see a pelvic health physiotherapist in the community for an assessment. Go on the Alberta Physiotherapy Association and College webpage to find a pelvic health physiotherapist near you at www.Physiotherapy.Alberta.ca. What is pelvic health physiotherapy? Pelvic rehabilitation is a specialized area within physiotherapy. Pelvic floor physiotherapists take postgraduate training. On your initial assessment day, your physiotherapist will ask you specific questions about your bowel and bladder, past injuries, surgeries, medical conditions, and childbirth history. The second part of the assessment is a physical exam. Your therapist may look at your posture in sitting, standing, and with movement. She may also do some hands-on or manual therapy to check the joints of the low back, hip, pelvic area. The therapist may also touch your abdomen from the outside to check the muscles and feel for soft tissue tightness. Following this is the vaginal and/or rectal exam. The purpose of the internal exam is to assess the tightness, strength, and function of the muscles of the pelvic floor. Physiotherapy treatment focuses on restoring pelvic floor muscle control. The ability to relax as well as contract the pelvic floor at the appropriate times is taught. Treatment programs may include pelvic muscle exercises, biofeedback, pain-reducing techniques, musculoskeletal treatment, trigger point therapy, bowel retraining and patterning, postural education, and relaxation techniques. Pelvic floor problem? Physiotherapy can help. The YouTube link above is from Physiotherapy New Zealand. It describes how physiotherapy can help your pelvic floor problem. In this module, you have learned where the pelvic floor is and what it does. You have been given instruction on how to find out if your pelvic floor muscles are working and a home program to work on. Many women have difficulty learning how to properly contract and relax these important muscles. For many, reading about these exercises or hearing about them will not be enough. See a pelvic health physiotherapist in the community to ensure you are exercising correctly. The Continence Foundation of Australia has developed a website called Pelvic Floor First. This website will give more information on pelvic floor exercise and pelvic floor safe general exercise programs.